Hi, everybody. It's Karen Anderson here with Aortic Hope, and this is our weekend review. And before we begin, we'd like you to click like and click the notification button so that you are notified every time we go like, and please consider sharing this. Now, we are not live. This is like Memorex, only for those of you that are young enough to understand what I mean when I say Memorex. Nevertheless, we are here with Terry Cook, board member of Aortic Hope, and Diane Bishop of Aortic Health Unlimited. Thank you so much for joining me. We are going to jump right into this because only the first couple of days are actually the remainder of August, and then we get to jump into some great stuff for the month of September, Aortic Disease Awareness Month. So let's just start hanging out and chatting, and we're going to start with Medical Monday. So what we wanted to do on that past Monday was share with you a wonderful presentation by Dr. Kristen Watson from the University of Maryland. Actually, what she did for us is put together a really easy to understand PowerPoint presentation of all of the common medications that are given to aortic dissection or aortic disease, aortic aneurysm patients. This includes many of, if not all of the various medications that are prescribed, as well as their potential side effects and any interactions they may have. And Dr. Watson's actually going to be participating in an upcoming closed support group meeting in October. The date is to be determined. But when you're part of this support group meeting, you'll actually have a chance to interact with her live and ask some questions. Again, her answers are not to be used to go in place of what your doctor has already set up for you, but maybe to be used as a way to start a conversation and ask some questions. And what I'll say about this presentation, for those of you that have not seen it, is it is so informative. Have both of you had a chance to look at this PowerPoint or be part of her live events before?
I was on the live event the last time we had her, and she was amazing. It was just so much information and stuff that I didn't know, that she's definitely great to have in our back pocket and have all of her information able to access.
Diane, have you had a chance to peek at this? Well, you should, because, you know, one of the things that we hear from patients and community members, especially if this is new to them and they wake up in recovery and now they're on this hefty regimen of potentially beta blockers, ACE inhibitors, calcium channel, all these drugs, and they're just not feeling great. And a lot of people don't like to take medications and they don't understand why certain drugs are prescribed. She does an incredible job of explaining why a beta blocker. What does a beta blocker actually do to our vascular system? What does an ACE inhibitor do? What do diuretics do? She goes through every single category of any potential drug that you might be prescribed and its various forms. So it could be a patch. It could be an extended release pill. And she explains why it's so important to take your medications at the same time every day, because these medications do not act like a Tylenol. They don't release in 20 minutes. It is longer term. And so sometimes these pills don't take effect for 2 hours, sometimes 4 hours. And so it's important for your doctor to know that you're taking them at the same time as being prescribed so that they see how your body reacts. Does your heart rate react the right way? Does your blood pressure react the right way? And I think the most important thing about this is if you're feeling so many of the side effects, right, Terry? Like if you're feeling really exhausted, or if you're having jitteriness or coughing is a well-known side effect, tell your doctor, because there's so many other medications that they can switch around and play with to make you feel comfortable. There's just no reason to feel uncomfortable.
That's so true, because I know after I had my surgery, got out of the hospital, I had to keep switching my medication, and some days my blood pressure was too high and I felt like my heart rate was too low, and it was just back and forth. And there are so many medications out there that can be used that, you can use her as a reference to talk to your primary care physician or your cardiologist.
Exactly. Diane, have you ever been in a situation where you've been on certain meds and they're just messing with you? They're not, and you've had to tell your doctor and then they've made switches?
Oh, yes, plenty of times, but, that's the beauty of it, having other things that you could turn to, but also that's why it's very important to take it at the same time and pretty much try to keep things consistent to routine, because you could pretty well, know what works for you and what don't, what could be causing this, what ain't causing this, but Yeah, there's been several times that I've had to switch to something else.
Right. And I think if you take a look at this yourself, you're going to see, oh, that's the drug I take. Oh, let me read about this classification. And you might realize that you didn't know what the benefits were of taking the medication. And she also goes into smoking cessation and why it's so important to stop smoking, and gives some tips on that as well, and how the sun might interact with some of these drugs. So it's a great PowerPoint. We highly suggest you take a look at it. And that was our Medical Monday. So let's move on to our Topic Tuesday. Okay, Topic Tuesday, an Aortic Disease Awareness Month. At the time this was posted was almost here. At the time you're seeing it, it is here. So September is going to be a very busy month for us, with a lot of education and a lot of information, plus some contests and giveaways sprinkled in as well. But we're going to show you the link in a minute. There's a lot of information that the Society of Thoracic Surgeons has been wonderful and generous in providing to the community during this month of September. And they actually give you a brief overview about our organization, Think Aorta, as well as information about Aortic Disease Awareness Month. And don't forget, we're asking everybody in all of your social media platforms to change your profile pic to the 3 hearts, and let's just make it a sea of red, and let's get people talking about aortic disease. So when you click on the link, what you're going to see is part of the patient website that is on the Society of Thoracic Surgeons page. So when you go to Society of Thoracic Surgeons, you'll look, there's a tab that says patient website or patient resources. And if you go into the website, you'll end up here on their guide to heart, lung, and esophageal surgery, because your aorta is in the thoracic area, hence thoracic surgeons. And we also have it in the abdominal area. So there is a link in which they will go over with you Aortic Disease Awareness Month. This is what they did for us last year. And they really go into a lot of details, sharing the ribbon that's been widely accepted, but they talk about what are thoracic aortic aneurysm and aortic dissection. And they're going to give you a lot of general, real quick information. They also talk about Think Aorta, whose goal is to increase the awareness of aortic disease among physicians and emergency personnel. In addition, we're hoping to expand that knowledge base and have the community think about their aorta and think about their family. So hashtag Think Family, Think Aorta. And the reason being, of course, is to prevent any of these issues from happening. The emergency issues, the more knowledge you know, the better equipped you are. And then they also actually have some information about a story that I provided for them. So we're not going to click that. But you will notice that for 2022 that they will have some additional information in their arsenal, and you can always click like the heart disease link, even though it's not heart disease, and you'll see here they offer heart valve information, thoracic aortic aneurysm, bicuspid aneurysm, aortic dissection. It's just so much information for you to check out, and we're really happy to have this continued collaboration with the Society of Thoracic Surgeons. So did any of you guys get a chance to check this out last year? And if not, will you be checking it out this year? Diane, Terry, Diane.
I did last year, and there's a lot of good information on this page for everyone to look at. And yeah.
Yeah, I think if you check them out, what you're also going to realize is they include, which we're going to share during the month, PDFs of the questions that you can take into your clinic office visit. So now that you've been diagnosed with an aneurysm, it's like 15 or 20 questions. What does this mean? Where is it located? Will I need surgery? What type of surgery? What's the recovery? It takes you through all these different questions that you can ask. There's easy to understand videos and graphics and all kinds of stuff that you can learn, specifically tailored for the patient base. So I don't really know many other societies that offer this. Not that I've been hunting, but I don't really know many others. This is the one that's been made aware to us, and it is such incredible information and very easy to understand. Terry, any thoughts?
Yeah, I'm sorry. Yes, I, of course, this time last year, I wasn't aware of all this because I was just through my surgery. But now that I know more about it, I would definitely check it out. The other thing, too, is the biggest thing with Think Aorta is that you need to think aorta, think family, because it is so true. I found out after my dad was sick that he actually had dissection. So you just need to read it understand it, and make sure you ask and think about family first.
Yep, absolutely. Good point. All right, we are going through some of our other posts that actually start Aortic Disease Awareness Month. And this began on Thursday, September 1st with it's Think It Through Thursday and officially Aortic Disease Awareness Month. So to better understand, this is where we get into a lot of information here. So let me gear it up. To better understand aortic disease, one has to know the aorta. And I'm probably right in saying that we've had our issues and our situations, and you probably didn't even know much information about your aorta, right? Didn't know. It's not like I took anatomy, or if I did, I don't remember. But this month, we're actually going to be helping to offer awareness, inspire, and educate you and your loved ones about many aspects of aortic disease. And this is why we designated an entire month to it, because there's so much information. So let's get into aortic information about the aorta 101. So there is a link where you can learn a lot of information, but I put up a summary here and we're just going to chit chat about it. So as we know, the aorta is what? The main artery that carries blood away from your heart and it goes to the rest of your body. And after the blood leaves the heart, it actually goes through the aortic valve and then travels through the entire aorta, making that candy cane shape that we all know and love. And it connects with all these other major arteries and vessels and delivers the oxygen-rich blood to your brain, to your muscles, and to your cells. And the aorta is, it's more than an inch in diameter. I know that we've had doctors explain that it can be almost 4 or 5 inches in some places. It really depends where in diameter in your body. So it's got 3 layers. And I'm going to butcher the names because I just know 3 layers. But so the most inner layer of this tube is the intima, and then the middle layer is the media, and then the outer layer. Anybody want to take a guess at that? Yeah, no, you're not going to do it. Okay. It's what it says on the screen. The adventici. I don't know how to say it.
You know what?
It's the outer layer.
Inner layer, middle layer, and outer layer.
Inner, outer, inner, middle, right. Inner, middle, outer. And what's important to realize about this is just these 3 little teeny thin layers that make up the aorta that carries all that blood through your whole body. It like boggles my mind when you think about it. So, okay, to continue on, when a problem occurs with the aorta, the heart and the entire body's blood supply is actually jeopardized. And when affected by disease, the aorta can actually split or tear or dilate. So a split or a tear, the inner layer splitting is the dissection, and the dilation is an aneurysm. And in either case, if it ruptures, which would be outward, it would result in being something fatal potentially. And there's 3 types of aneurysms, which throughout the weeks coming ahead, we will actually talk about in great detail, but you can actually have an abdominal aortic aneurysm, a thoracic aortic aneurysm, and a thoracic abdominal aneurysm, which I didn't even realize you could have 3. I thought it was just 2, but the thoracic abdominal is kind of in the middle area because your thoracic is upper, your abdominal is lower. So thoracic abdominal still in that higher yet lower area, but you're not one or the other 2 distinct areas. And we're going to talk about these in greater detail, but also we're going to talk about the diseases that can occur. And there's a variety of diseases and conditions that can cause damage to the aorta and put patients at great risk, life-threatening risk actually. And those conditions include atherosclerosis. That was good. And don't ask me to say it again because I think I said it right the first time, but it's hardening of the arteries. Don't laugh too hard. Hypertension, which we know is blood pressure issues, high blood pressure issues, genetic conditions such as Marfan syndrome, connective tissue disorders such as Ehlers-Danlos and Loeys-Dietz, and I can't pronounce all of these, polychondritis, scleroderma, osteogenesis imperfecta. Can't see everything on the screen. Let's see. Oh, polycystic kidney disease, and I think Turner syndrome, or injury, meaning if your airbag goes off in your car accident, that's potentially can cause a dissection or cause you to have a weakening in an area of your aorta. So much to talk about with the aorta, as we clearly see here, and we are going to dive into that all week long. Just give me some thoughts. Try to pronounce the words, ladies. I triple dog dare you. Go ahead.
One of my thoughts, Karen, if I could jump in, you're mentioning all these conditions, but what a lot of people do not realize, you don't have to have one of them conditions. You could all of a sudden, through bearing a child or an accident, and it could cause you to dissect. So just because you're healthy as a horse, don't take it for granted. It can happen to you. So that's the importance of it. A lot of people think that they're limited to, oh, that's just if your mother, your father, or grandpa, or that's just if you strain or just lift weights. There's so many other factors that can affect you that you don't realize. So no one is immune to this condition.
And one of the things I actually heard today speaking with a surgeon is that the majority of dissections are not due to an aneurysm. So many people end up having a dissection, and what they're told when they come out of surgery is there actually wasn't even an aneurysm there to begin with. So let that sit with a lot of people. We all assume that there's going to be this massive issue that's going to cause that. And you're right, Diane, it may be, there's going to be something, but it might not be something that you can see.
Right.
So that's why family history and discussing that is so important. Go ahead, Terry. What were you going to say?
The interesting thing, you said you were talking to a doctor that there's not an aneurysm. What actually happened with my type B dissection, it was controlled medically until it formed an aneurysm. So there wasn't an aneurysm. I had the dissection, and then the aneurysm formed.
Right.
So.
Yeah. So you're not necessarily looking for something that's so obvious. And like you had mentioned before, the key is know your family history, because if someone else in your family's had this happen, you need to be followed. You need to be followed. Your aorta should get pretty pictures, and we should know what's going on and get a baseline and have that monitored for changes, potential changes.
Correct.
A lot of information about the aorta. That was Aorta 101. We started the first day. We are moving into our first Friday fundraiser. We do this every single month, but this is so exciting because today we're announcing a collaboration with an organization called Jewel Promise. And Jewel Promise actually supports various causes and raises money by creating jewelry, keychains, even wine glass charms. And 25% of your purchase will actually be donated back to Aortic Hope. And so we've included a couple pictures here to show you. So we've got the wine glass charms. This is this looks like it's one of the charms that you can attach to a bracelet. It could probably even be attached to a Lawrence Hope bracelet. Just saying. This is the necklace. This is the bracelet. Looks kind of similar to some other bracelets. The name brand will be withheld that many women are used to seeing out there. And this is the keychain. So pretty cool to see all of the different items that they offer, and they'll put your logo on it. So you just need to click the link and get an opportunity to purchase some swag. It would make a great gift for the holiday. Do some early holiday shopping, or get your swag for the month of September. Start that conversation about aortic disease today, and just know that 25% of whatever it is that you purchase will be donated back to us, and we use 100% of the funds that we raise to give back to all of you. But this is so exciting, and we're hoping, right, Terry? We're hoping that we can continue this relationship even after September. We're going to see how September goes. But I mean, check it out. It's pretty. They offer some pretty great items here. I love the wine charms. I think they're so cute.
Take my money. I'm getting one of everything.
Take my money. Take my money. So that's our first Friday fundraiser. Okay. And actually, here's what the website is that they created for us. So they did all of this work for us, and shipping is free if you spend $25. If you spend under, then they're going to charge you about $4.95 for shipping. But as you can see, the prices for these items are not even expensive. Your wine glasses, 2 sets, are only $24. A purse charm or a bracelet charm is $12. That necklace is only $19. Your keychain's $12, and your bracelet is $15. Not bad at all.
The necklace, we have to make sure that people click on it, because you can get different lengths of necklace. You can go like 16, 18. Oh, yeah.
What is that tomfoolery? Wow. Okay, so you can get in the necklace 16-inch, 18-inch, 20-inch, or 24-inch.
Mm-hmm.
For
Right.
89. Okay, I can already see Terry's wheels are spinning here. She is going to purchase everything. But a great, wonderful collaboration. We're so excited to offer this to you. So consider clicking on that link and getting something today.
And I just want to give a shout out to Deb from our board. She is the one that actually found this and sent it to me. And then I proceeded to contact them and figure it out. So thanks, Deb. We really appreciate the help on this. And you have to buy everything also.
Yes, we try to encourage everybody to keep their eye out for organizations like this that are willing to, offer a little bit of a kickback if we think it's going to be a product that that the community might enjoy. So there's one. Thank you, Deb, so much. Okay, this leads us to Saturday, and we designated it Surgeon Saturday during Aortic Disease Month. And this is another interesting topic because we do get questions about this a lot, but what's a cardiothoracic surgeon? So without reading, what would you guys say to that answer?
Say that again.
What is a cardiothoracic surgeon?
To me, before all of this, I just thought they were all heart doctors. They operate on your heart. That's all I knew.
Diane, what did you think?
Before all this, I'm with Terry. Something that a doctor that specialized on a certain part of the heart.
Mhm.
But I
That's what
thought
I
too.
thought.
I thought they were just strictly heart, but clearly a thoracic surgeon, really a thoracic surgeon can do anything in the upper chest area. So let's learn a little bit from the Society of Thoracic Surgeons. A cardiothoracic surgeon is a medical doctor who specializes in surgical procedures of the heart, the lungs, the esophagus, and other organs in the chest. This includes surgeons who can be called cardiac surgeons, cardiovascular surgeons, general thoracic surgeons, and congenital heart surgeons. Cardiac surgeons, cardiac, thoracic, cardiothoracic surgeons will graduate from medical school and go on to complete either a 5-year general residency, followed by a 2 or 3-year cardiothoracic surgery residency program, or enter into a 6-year integrated cardiothoracic surgery residency. Told you it's a lot of information for this month. My mouth is going to get very dry. Okay, some cardiothoracic surgeons choose to do additional training in a subspecialized area, but this training is optional with the exception of congenital heart surgery, which requires completion of a 1-year fellowship. If you want more information regarding the role of a cardiothoracic surgeon, click on the link. Again, that takes you to the Society of Thoracic Surgeons, and it's very easy to understand information. So there you go.
Needless to say, these surgeons are very, very educated and know what they're doing, because obviously they've saved our lives.
Right.
So, they're not just heart doctors.
It's a tough role. I mean, imagine like mine got called in and right around 11:30 at night, he'd been home, he had his dinner, thinking he's going to sleep well. Nope. He got called right back into surgery.
No, mine was like 3 or 4 o'clock in the morning.
Wow.
Yeah.
Yeah.
It's pretty amazing. It's pretty amazing. So there's your role. If you have questions about it, check it out. Check out the link and see. But again, trying to explain a lot of information for AD Awareness Month. So again, this is one last reminder coming up about, we call it Signage Sunday, but our 4th annual Community Hope Campaign is still in full swing. The campaign is truly all about you, and it is continuing through Wednesday, September 14th. We offer you this opportunity to share with the community what hope looks like and share with other people things you have in common, which is living with aortic disease. So email us a picture. It can be of yourself, it can be of your dog, it can be of your doctors, it can be of multiple pictures. Go to your family reunion, first kid going off to school, doesn't matter, whatever hope means to you. Send us that picture at info@aortichope.org and just put the word hope in the subject line. On September 19th, Aortic Disease Awareness Day, the video will be shown with all of the photos that are submitted to us. But remember, by submitting your photos to us, you're granting us permission to display them on Facebook, Instagram, YouTube, website, all these different places. And these other organizations could share them as well. And we offer no monetary payments for your pictures or participation. So who sent their hope picture in? Hmm. We might just
I-
secretly take a picture of you right now, Diane. So smile. No, I'm kidding.
I have, but now that you said that, I think I'm gonna take one or send one in of me and my family because they're the ones that got me through this. So
You
yeah, I
should.
may look pretty on the cruise, the one that I sent you, but I think I'm gonna do my family.
You should.
Terry, I told her the one of us, at the Poconos
Yeah,
with the camel.
with the
That's
camel.
a good one to put on. Yes.
Yep.
Yeah.
We need to do that. Or
Yes.
take one of you and Sarge.
Sargy Party, poor, bless his heart. Yes.
All right. So that is our Sunday, and that really wraps up the end of August, first week of September. Again, we were doing this recorded for all of you, but if you leave us a comment, we'll be more than happy to respond. We have such great things coming up in the month of September. We're adding speakers all the time and events that are going to be happening, and lots of information for you to learn. So please remember, this can happen to anyone. Dissections are rare. Aortic disease is much more common than you think. So share this on your personal pages. Get it out to people that you wouldn't think necessarily need to see it. But, if you have a history of heart disease or cancer or diabetes or stroke or aneurysms, even inflammatory diseases, people need to read about this because you could potentially be at risk for developing an aortic aneurysm. And you might want to learn about all this, this education and this additional awareness. So thank you, ladies, for joining me today. And we will see you again. Tammy will be hosting our September 12th live weekend review. We hope to see you then. Thanks again.
Thank
Take
you.
care.
Thank
Bye.
you. Good night, everybody.